You can save that and recycle it.
Yeah, we'll recycle. And then we'll alternate on the questions.
Sure.
So, and I'll guide you guys through all of that, and I'll repeat the questions. And we want it to be as easy for you guys as possible, so just let me know if I didn't.
Yeah, and I have a 30-second timer, so
Yes.
I'll give you that for your, and then a stop.
Perfect. Any questions?
30 seconds before the 2 minutes, is that
Yes.
what
Yes.
1 minute is?
Yep.
Okay,
Yep.
all right.
It's already, does the lighting look good?
It does.
Okay,
Very good.
alright. Should I go?
Yep. Let's do it.
Welcome! Welcome to our forum featuring the Kansas House of Representative candidates for the 28th District of Kansas, which includes parts of Leawood and Overland Park. I am Molly Haase with the Leawood Chamber's Legislative Task Force. And on behalf of the Leawood Chamber and the Overland Park Chamber, we both really appreciate your participation in this process. The Johnson County Public Policy Council is a collaborative effort of 10 chambers of commerce representing more than 5,000 Johnson County businesses. In addition to hosting forums like this, the council conducts other voter education efforts, including publicizing a wealth of candidate information on the council's website, which is VoteJoco.com. And that's where this forum will be posted afterwards. So first, I will welcome and introduce our candidates. We'll start with Carl Turner. He is a career financial process improvement and project management professional, lived in Leawood for 32 years and previously involved in Leawood Middle School Parents Group, coaching athletic teams for his daughter, and previously president of the neighborhood HOA. Carl is serving his first term in the Kansas House as a Republican and elected in 2020. Ace Allen. Ace is a retired physician with his career serving the Kansas City and Topeka Veterans Affairs Hospitals, VA hospitals, and KU. The past president of his congregation and past board chair of the Jewish Community Center of Kansas City, and also founded 2 healthcare startups. Ace is a Democrat. So here is the brief overview of our format. Each of you will each give a 2-minute opening statement. And then after the opening comments, we will rotate back and forth with questions written by the Public Policy Council. We are not taking questions from the audience, and this is not a debate, it's a forum, so we've not built in any time for rebuttal. At the conclusion of Q&A, we'll give each candidate 1 minute for closing remarks. Prior to the forum, we drew numbers to determine who would speak first. Based on that random drawing, we will begin with Ace Allen and his opening statement. Ace, go ahead.
Thank you very much to all. I want to just introduce myself a little bit more. My business life and my life in general are actually quite intertwined from the day I was born. My father was born in Canada, Jewish refugees from Lithuania, and was a business pioneer who ended up in California, where I was brought up. I wasn't born there, but I was brought up there. As a business pioneer in the field of management, professional management. This is one of his seminal books. He wrote a whole bookshelf of books about this, and was a real pioneer in this area. And I grew up with his precepts and his kind of thought process about business and the importance of business. My mother was is from a family that has Kansas farm roots, so back 150 years. I still have relatives in Lynn County, in Pleasanton and Blue Mountain, originally from Blue Mountain, but now Pleasanton. And she's a physician. She was way before her time, and actually worked with Dr. Spock, and my twin brother and I were Dr. Spock babies. I just want you to know. And with my 3 brothers and sisters, we helped our parents keep the house in order as we were growing up. After a long series of work adventures, I ended up going to medical school at KU Medical Center. I started there in 1979, but I came here a year and a half before that. And I never looked back. I had my aunt was the head of Medicaid's nursing. I came here. I never looked back. I loved it. I loved the expansive nature of it. I loved the welcoming, the opportunity, the people. I even loved the weather. I became an associate professor of oncology. I traveled to a lot of rural clinics. I helped start the telemedicine program.
Go to Carl Turner for his opening comments.
All right, well, good afternoon, and thank you, Molly, and thanks to the Chamber for hosting this forum. My name is Carl Turner, and I'm the current representative in Kansas House District 28, which is roughly 2/3 Leawood, 1/3 Overland Park. I'm not an activist with an agenda, nor am I a politician. It was actually my first run in elected office when I was elected to this role 2 years ago. I graduated from Raytown High School and earned my degree in accounting at the University of Central Missouri. I then started my career and took night classes to get my MBA in finance at Rockhurst College. Later, during my career, I went back and got a certification as a project management professional. My wife Jenny and I have a blended family of 3 adult children, 3 grandchildren, and 2 more on the way, 1 in November and 1 in January. I've been a Leawood resident for 32 years. I care deeply about our community. So in addition to being the state rep, I serve also as the president of my HOA and volunteer with civic and charitable groups. My background of building teams and solving problems fits well with the role of state representative. I've also enjoyed helping people in the past 2 years, I also enjoy helping people, and in the past 2 years I've enjoyed working with hundreds from the district as they visit the Capitol to sit and discuss their ideas, and they need help navigating state agencies, especially the Department of Labor over the last 2 years dealing with unemployment issues. I appreciate the trust of the people and that they put in me when they elected me into this position. I take it very seriously. I put the time in to do it well, and I'm known as the guy that actually reads the bills. Elections are about the future. My opponent and I have very different visions about the role of government in our everyday lives. He's trying hard to convince folks that he's a moderate Democrat, but of course that's not true. He's written many letters to the editor of the Kansas City Star over the past 25 years to share his viewpoints, which I find is very far to the left. With that, I look forward to today's forum, and again, thank you to the Chamber for hosting.
Thank you both. All right, we'll start with our questions, and Carl will have you answer first.
Okay.
As a candidate, what are your top 3 policy issues?
The 3 areas really I grouped into 3 things: defend and improve our quality of life, and in that I mean the quality of education, quality healthcare, safe streets, and strong neighborhoods. The things that really draw people and keep people here and they enjoy in this area. Number 2, lower the cost of living, and I'm talking smaller government, lower fees, lower taxes, more energy choices, which I think will give us a lower utility costs. And the third one is to grow the economy, and I mean spur investment and growth of the private sector, businesses through decreasing needless regulation and reducing the tax burden so it's easy to set up shop and do business in Kansas.
Thank you. Ace, what are your top 3 policy issues?
Some of them I share with Carl. One of them is to maintain and improve our superb public schools. I don't know if we agree on the public part, but certainly the school system is the crown jewel of our state and is what attracts people here. It's what's keeping me and my wife and family here. And without that, a lot of things start to fall apart if you don't have a good school system. To expand Medicaid, this is an unforced error on the part of the state of Kansas. It's one of 12 states that doesn't accept Medicare expansion. In fact, our next door neighbor, even the benighted Missouri, accepts Medicaid expansion, has had Medicaid expansion, and we've lost out on almost $6 billion in revenues there since 2017. In terms of business matters, I agree with Carl on the lowering taxes. Absolutely, Democrats have been actually fairly heroic in doing that here, and sometimes not being able to do it because they were stymied by a right-wing supermajority in the state legislature. I agree with Carl on the more energy options. I've been a really strong proponent of electrical vehicles, of wind power, and solar power in this state, there is no reason why we shouldn't be, as the great state of Kansas, we shouldn't be thought leaders in this and actual leaders in development and production of alternative fuels and types of buildings and environmentally related matters like that.
Thank you. Moving on to our next question, and we'll start with Ace first. What are your views on our state tax policy, And please be as specific as you can.
Sure, yes, I mean, one of them is I think we're gonna agree on this to a point. One of them is to eliminate the very regressive state tax on food and diapers and so forth that we have in this state. This is Kansas is one of a very small handful of states that has a tax on food. There was, as I understand it, there was a bill presented, the so-called Axe the Tax bill, to eliminate food tax now, and there was, unfortunately, this is where we may disagree, that was every Democrat that voted for that, especially in this time right now when their inflation is causing a lot of pain for a lot of people. But the idea, though, is to do it immediately and not to wait 3 or 4 years, which is what was actually passed again by a right-wing supermajority. So those are some of the things that there's other ideas too, but that's one thing that I would do right away. There's certainly, we can reintroduce, bring on board the actually state mandated ad valorem tax, which is a kickback, and that's a kickback in a good sense, not a kickback like in a physician sense. It's a good kickback from the state of state tax monies to local communities, so that they in turn can reduce the tax burden, the housing tax, housing tax burdens on families. That's again legally mandated since 2001, but for the last 10 or 12 years that has not been actually enforced. We need to enforce that, and there are other measures as well that it looks like I don't have time for.
Thank you so much. Carl, what are your views on our state tax policy? Please be as specific as you can.
Okay. Well, thank you. I actually serve on the tax committee, so I've seen how the process works. My thoughts on this is that we really need to improve the tax climate for businesses and individuals in this state, period. The past 2 years, we've been able to make some meaningful reductions, both in income and property taxes. We've increased the standard deduction and reformed tax law to allow Kansans to get the full benefit of the 2017 tax cuts by allowing itemization on your Kansas return, even if you take the higher federal standard, or this federal standard exemption. That was a huge savings to the folks in Kansas. We also passed a property tax transparency bill that ended the automatic increase whenever your assessed property value went up. Now they send notice and they have public hearings to hear from the folks, and they take a public vote. With the food tax now being phased out, it's my view that we need to review the agricultural exemptions and actually do a restack of our entire system to widen the base and lower the rate for everyone.
Thank you.
Mm-hmm.
We will move on to the next question. This time, Carl, you'll go first on answers.
Okay.
What are your views on our K-12 education funding and accessibility?
All right. Well, I'm a strong supporter of education. There's two words that seemingly get interchanged, and that's schools and education. I vote to give every kid the best opportunity to get the best possible education in this state. The reputation of our Blue Valley schools attracts people to the district. Residents are understandably proud of the schools and pay a lot of tax dollars for them. About half of our property tax bill and half of the state general fund goes to K-12 schools. For those dollars, they deserve top results. I'm disappointed that those that claim to stand for schools never want to talk about education. We need to and do fully fund schools, funding with accountability to perform so that when our kids graduate, they're well educated and they're set up for success in life.
Thank you. Ace, what are your views on K-12 education funding and accessibility?
It is the crown jewel. Education is a crown jewel of our region here, of Johnson County, Blue Valley. Anything that would sway us away from that emphasis and that public triumph, would be inimical to our interests as a region. I do not support the diversion of public monies to private schools for a lot of reasons. Our kids went all the way through private school, by the way, and we never asked for or expected public monies to support them. Don and I, my wife and I, both grew up in very strong public school systems and are very strong supporters of a public school system. problem with private schools in terms of diverting money to them is twofold. One is that you're also diverting money to religious training, and not directly, but by diverting money from other areas that can then be rediverted into religious training, which may or may not be in how you would want to be spending your public monies. The other problem is that private schools do not have to accept special needs kids. There's a lot of those out there, and private schools don't. Again, they can shift them back to the public municipality, and so they've washed their hands of it, so to speak, or they're just unable to do it because of their size or inclination, and that's not fair. That burden then would go over to public schools. I think the small classes are critical. They've been threatened, as you all know. Over 150 teachers have left the Blueberry Valley school system, not because they were aging out, but because they were kind of hounded out. They just couldn't take the grief that they were getting in terms of undue oversight and so forth, and disrespect. And finally, I really emphasize the importance of trade schools and expanded education for trades and so forth, starting in high schools. And I think it's one of the things that the CAPS program does here, which is just extraordinarily a real beacon for our area and for the country.
Thank you. Our next question: what types of economic development policies do you support to encourage job growth and business expansion in Kansas? And this time, Ace, we'll start with you.
Okay. Yeah, so there's a chicken and egg thing going on here, and that is economic development. Education is an economic development policy. The state level, the laws that we have, legislation that we have at the state level is an economic development policy. Companies will not come here, or they will think twice, and they shouldn't have to think twice to come here. If they're wondering about if they have a gay kid, a homosexual kid, if they have a trans kid, if they think if they think it's okay to carry a gun on the school, it's okay. It is legal here for an 18-year-old. Did you know this? To carry a gun on a school campus, not into the building, but on a campus. Those are economic development. Those are in back of economic development policies, and if we don't get those right, we're going to continue our out migration of students and of our kids as they get through school. Right now, Kansas is the the sixth out of 50 states. We have the most out migration compared to in migration, and we know that because there are a whole lot more U-Hauls leaving the state than are coming back. So that's kind of a background, thoughts about the background of business development. If you don't get that part of it right, those parts of it right, the business development part is going, you can have the best business development policies in the world, but companies aren't going to, and young talent is not going to come here.
Thank you. Carl, what types of economic development policies do you support to encourage job growth and business expansion in Kansas?
Well, I talked a little bit about my background earlier, accounting, finance, and analysis. So, I look for numbers. I'll support any business case that's based on accurate data with an acceptable level of risk that shows a positive cost benefit and a reasonable payback. I know that's a bunch of jargon, but I mean, basically I quantify, say, what do we got here? And I'll decide based on that. I also support accountability for economic development dollars, such as the legislative post audits that were done. They did them on the Star Bonds program last year, which I thought was very interesting to kind of see what the original projection was for some of these initiatives and what the actual benefits achieved were. But I would agree that fundamental to ensuring that businesses want to locate and remain in Kansas is really about making it a friendly environment. Less regulation, less government mandate, lower tax burden on existing businesses. So.
Thank you both. Next question, Carl, this is one you'll go first. What would you do to grow and develop the state's workforce?
I support state programs to retrain workers and bring their skills to a level that makes them more prepared and employable, especially in a time of high unemployment. But even now, when we're kind of constrained for new workers. So retraining, I completely get it. I think the benefit is there to do that. You know, we also have colleges in our states, or in our state, that attract students from all over the country. And we have an incredible facility at the Johnson County Community College that teaches skilled trades for things such as plumbing and auto mechanics. So we need to do more to keep graduates here in Kansas, because they do get attracted here, and then often they don't want to stay in the state once they graduate. So to that end, we passed the Promise program that helps pay tuition for the student if they agree to work and live in Kansas for the 2 years post-graduation. I think that's a great program. I think we need to do more, but I thought that's a great first step.
Thank you. Ace, what would you do to grow and develop the state's workforce?
Yeah, another to augment what my opponent was saying just now is there's locally here in the local regionally here in Johnson County we have the Green Business Program, which is a really exciting program. It's a blueprint, an actionable blueprint for bringing green businesses here to Kansas City, to our region. This is by state, by the way. I think that Kansas City is losing a big opportunity and losing a lot of young people if we don't position ourselves as a place where you can start really exciting green, environmentally sustainable companies that make sense economically and that are well managed, and that we don't get in the way of them in terms of undue red tape and so forth. So that's what I have to say about that.
Thank you.
You're welcome.
Next question, this time Ace, you'll go first.
Sure.
What are your views on the state's role with respect to ensuring access and affordability of post-secondary education?
I have to tell you, I don't know that much about this. And albeit now I'm looking at yes, I did get this question before, and I'm not faulting you for not knowing much about it, about what the role of the state is in this. One of the things that I was always insistent with my students when I was teaching as an associate professor of oncology was, if you don't know the answer, just say so and don't fake it. And so I don't have a great answer to that role. We have talked about in terms of post-secondary education, just to make sure that we're not leaving out that significant proportion of kids who just are not academic material. They're just not, and it doesn't mean they can't make a good living, make a good contribution, and it's just not where they live is in an academic headspace. So that means I think Carl mentioned what we've got going here at the Johnson County Community College. Beautiful programs there, trade schools, apprenticeships, and so forth. The DeBruce Foundation downtown here, a $1 billion foundation, is dedicated to helping young high school and early college age kids, post-high school, sort out what it is that they are doing with their lives if they're not going to go to college. So there are nonprofits that we can work with to help in this area, because those kids, if they get the right jobs, they're on. If they don't get the right jobs, and if they feel discouraged and left out, we all pay for that.
Thank you.
You're welcome.
Carl, what are your views on the state's role with respect to ensuring access and affordability for post-secondary education?
Well, as you kind of hear a theme, I mean, I'm kind of an accountability person, so I recognize that the state not only has a funding role, but also an oversight role, that the taxpayer funding is being used efficiently and effectively and in student-focused ways to achieve results. But of course, those institutions have the primary responsibility to manage their operations, to keep tuition affordable, and make their programs accessible to folks. So.
Thank you. Okay, we'll move on to the next question. This time, Carl, you'll answer first. What do you believe the takeaways for state lawmakers should be from the COVID-19 pandemic experience?
Well, that was a long period of time that we dealt with this in the House, and I can tell you that much has already been learned. It was, as with many things during the pandemic, I mean, nobody had all the answers. We were all navigating our way through it. But I would say that much has already been learned and acted on. Among the lessons, emergency powers that were set up were never intended to be for prolonged 2-year emergencies. So we worked on that. All businesses and workers are essential. A governor should not pick winners and losers. Businesses can innovate and adapt to operate safely if given a chance. I believe strongly in that. So a couple of other points. Call centers in the unemployment system must be quickly scalable. We learned that hard lesson. They didn't ramp up, and that was a struggle. And lastly, the people of the state, either directly or through their elected representatives, should have a voice in the policies that they're asked to abide by.
Thank you. Ace, what do you believe the takeaways for state lawmakers should be from the COVID-19 pandemic experience?
Yeah, what a tough time. I think we need to listen and take to heart information from epidemiologists, scientists, public health experts. They're going to be wrong sometimes, but they're going to be wrong a lot less than lay experts are. And as a general principle, if you're going to make a mistake, I say err, and this is from a medical perspective, if you're going to make a mistake, err on the side of caution. I think the governor did handle a very, very tough job, actually very well, in the face of a lot of flack from a lot of people. And I'll give you an example. Our then running for state for the senator from our great state of Kansas, a physician was flouting the state's rules wide open in the middle of the worst pandemic in 100 years, not wearing a mask, actually almost insisting that the people around him not wearing masks, at least they weren't in any of the publicized meetings. We don't know how many people were infected from that. We don't know how many died, and yet he is our senator. To me, that's medical malpractice and it's political malpractice. I think in terms of communication plans, and so I don't know how good the communication is always difficult. It's especially difficult now when we don't have a central channel of communication for the United States or for the state of Kansas or anywhere anymore. There's no newspaper, there's no 5 o'clock news. So it's very difficult to get information that is commonly recognized as authoritative to every person, and I don't have a great solution for that. I should note also that Kansas was actually pretty conservative in this. We were the 37th out of 50 states to close our schools. We were not some aberration out there. We were actually right in the middle, or even a little on the conservative side in how restrictive we were and how we handled this. And the outcome of this in the state of Kansas could have been a lot worse. We just don't know. We just don't know how it could have turned out if we hadn't had those restrictions.
Thank you. Our next question on healthcare, and Ace, this time you'll go first.
Yeah.
What are your views on healthcare policy for the state and Medicaid expansion?
Well, Medicaid expansion comes first because that's the bulk of what we can be doing in terms of healthcare policy here. Medicaid expansion, I mentioned before, is an unforced error on the part of the state. Now about $6 billion have been lost to this state since 2017. When Kansas was one of a small handful of states that were declined to adopt Medicaid expansion. We are paying into this. We're paying into the federal kitty, but for political reasons that I cannot explain, perhaps my opponent can. We decided not to take that free money. It's free money to help 150,000 people get care that they. And these are some of them are indigent people, just simply incapable of work. Some of them are physically unable to work. As a result of them not getting that money, that federal money, small clinics, 7 of them, as far as I understand, around the state of Kansas have closed since about 2017 or so. Recently, 2018, Fort Scott Hospital, south of Mercy Hospital, Fort Scott closed. I spoke with one of their executives at a big event about a month ago, and she confirmed that a big part of the demise of that hospital was because they couldn't get the Medicaid expansion. Those patients, as a result, now the full paying patients go to Nevada across the state line. And by the way, as I think I mentioned before, even Missouri accepts Medicaid expansion, so it's not clear to me. So we've lost that money to Missouri. We've lost the input to patient health for those 150,000 people, and we've lost that money to our local hospitals here too, within Johnson County.
Thank you very much. Carl, what are your views on our state's healthcare policy and Medicaid expansion?
Well, this topic of Medicaid expansion has been out there since 2010, and it quickly becomes a soundbite that we don't even really talk about anything beyond it. So I'm always open to discovering, and we continue to evolve in the healthcare committee in terms of teleaccess and making healthcare more accessible and more affordable. Always open to that. But in the area of the actual Medicaid expansion, in my 2 years there, we haven't actually seen a bill, so I have done some studying and some reading, but I've never actually been presented with a bill. But the experience that I see from other states that have expanded is that expansion is attractive in the short term, but not sustainable over the long term. And I say that because costs that these states have experienced have greatly exceeded what they expected, and the cost eats up a greater share of their budget each year. Medicaid was designed to take care of our most vulnerable people, such as folks with disabilities, low-income children, and pregnant women. The 2010 ACA, also known as Obamacare, gave states the option to expand Medicaid. That expansion would put able-bodied working-age adults on taxpayer-funded health coverage. And Medicaid was never intended to provide for this population. So as an incentive to expand, the federal government offered to pay a higher share of the cost. And I think there was a proposed rulemaking, but I don't know that it ever got made permanent, the higher level of like 90%. So if the federal funding were to revert back to the more normal prior to expansion 55% funding, it would leave a huge cost burden to the states.
Thank you. Next question, and this time Carl, you'll answer first. How control over decision-making is divided among the state legislature and local governments, including school board, on issues such as taxation, economic development, and education has been a matter of debate. What are your views on this issue?
I say that ideally state government works in coordination with those local boards, local councils, and that is really the best model, and the one that I've seen work very well in the economic development area. Otherwise, short of a local entity enacting laws that conflict with state policy or the greater good of the society, then decisions and accountability, in my view, for those decisions are made better at the local levels.
Thank you. Ace, how control over decision-making is divided among the state legislature and local governments, including school boards, on issues such as tax, economic development, and education has been a matter of debate. What are your views on this issue?
It gives me great pain to have to announce that I largely agree with my opponent on this. I think that as much as possible, as much as it makes sense, more local control, local regional control should trump state issues, unless there's a matter that only a state can deal with in terms of the intrastate equivalent of interstate commerce in terms of what rules that may affect one county or one area or one town may impact a nearby town, and that there may be a role there for the state government to step in. But this is something I'm really looking forward to digging into when and if I become a representative from House District 28. I look forward to facing this question, these challenges.
Thank you. Our last question, this time Ace, you'll go first. What do you believe most distinguishes you from your opponent in this race?
Well, I think some of it's become clear here. I am strongly in support of Medicaid expansion. I think some of the things that Carl disagreed with about that are misinformed, but that's for another wider, broader debate. I do not support the right of an 18-year-old to carry a loaded weapon onto a school campus. This is actually what got me into this race. And I found out that my opponent voted for this. He also voted, I think multiple times, I'm not sure how the vote sequences go, for no abortion, even in the face of rape, incest, tubal ligation, or tubal pregnancy, and so forth, as far as I know. But there were no exceptions, or for the life of the mother. Those are anathema to me. I don't think they're supportable, either from my ethics, my religious viewpoint, or frankly, practical viewpoint, or medical viewpoint. So that's the other thing is that in terms of, I think my dream is to see Kansas as a place where our children and our grandchildren want to come to live, if they've left, to come back, and if they're here, to stay here. What will attract them is a big, expansive view of what we are as a state. It's a welcoming state. We're not pushing people away because of they're struggling with gender identity or whatever it is that other people might find too uncomfortable to be bearable. They don't have to worry about whether they have control over their bodies. This is men and women, because we don't know where this would stop if the so-called pro-choice movement becomes ascendant. That both men and women, they find that they have a lot less choice over their health and healthcare than they ever thought they would lose. So those are two of the differences.
Thank you. Carl, what do you believe most distinguishes you from your opponent in this race?
Well, I think there's a striking difference between us. Some of the characterizations of my votes have been misstated, and I'm not sure exactly what, as he says, that's for another time and day. But anyway, I would say that I'm not a politician, but a businessman and a team builder that gets things done. I grew up in the Kansas City area. I went to school here. I went to college here. My whole life, I have Kansas values. I view myself as a pragmatist that's just looking to solve problems, and I'll work with anyone to get that done. In contrast, my opponent, as he says, he grew up in California, went to Berkeley, and now he wants to bring the California viewpoint here to Kansas, and I just don't understand how that's ever worked out well. If you look at states like California, for example, that's been run with progressive ideas for any length of time, you'll see that taxes are high, crime is high, and people are leaving the state, and businesses are leaving the state, and we don't want that here. So.
Thank you. Now we'll have you both give just closing comments for 1 minute, and this time, Carl, you will go first.
Okay. Well, thank you, and again, thanks to the Chamber for this opportunity. Like I said, I was not in elected office or in politics at all before I went. Ours is a citizen legislature, and I went down there as a citizen from my district to look out for the best interests of my district. I don't have an agenda. I'm not a hyper-political person. I will never have the most followers on Twitter, but the people of this district know me, and they trust me, and to go to Topeka, to read, to listen, to learn, and to find answers. I've worked hard to earn that trust. I've helped hundreds with unemployment issues and made new friends in the process. I've walked the district to share my views on a wide range of issues, and we've made good progress in the past 2 years, but there's much more to do. With all the bad policy coming out of DC, people are fed up and hurting. Prices are way up, crime is up, and their 401k accounts are way down. It has been a lot of work, but an honor to serve the people as your state representative, and I ask for your vote on November 8th.
Thanks, Carl. Ace, how about your 1 minute closing remarks?
Yeah, thank you. I was kind of amused by the cavil, the CAVIL folks, that I'm a Californian, and therefore Carl thinks he knows something about me. He may be aware that Ronald Reagan is from California, actually. My father was a Republican, my mother was a Democrat. Your argument doesn't work, Carl. I'm here, I'm a Kansan by choice. I love it here. I have much deeper roots, I suspect, than you do here in Kansas, Carl. And I still have relatives here. Their farm genes within me, and their business genes within me. I've worked for almost 40 years as an oncologist with cancer patients and their families making the most difficult decisions they've made in their lives, and I've had to work with them to find a solution that worked best for them, and work with my colleagues to make that happen. I can bring those sensibilities and those talents and my ability to listen and form coalitions to my role as a representative of House District 28 in our great state of Kansas.
Thank you. Thank you both so much for taking time out of your busy schedule to do this and participate in our forum and being willing to serve the people of Johnson County. It is really appreciated that you took part of this today. I want to thank the Leawood Chamber and the Overland Park Chamber, especially their staff, for helping put this together, and remind everyone who is watching this video that along with other election-related information, this forum and others will be available on VoteJoco.com. Last reminder that advance voting in person begins on Saturday, October 22nd, and Election Day is November 8th. Thank you all.
Thank you.
Nice to meet you.
Good conversation.
Good job.
I want to say that
Thanks, Taylor.
I
Whoop whoop.